Hip pain can keep you from enjoying the activities you love. Today, Dr. Want to say it right, Orbegozo,
That is right.
I love that name, joins us from Florida Pain Relief Group to discuss how they can get you out of pain and get back to the life that you enjoy. Good morning, doctor. How are you?
Very good. Thank you.
Thank you so much for coming on today, because I feel like you hear people talk about hip pain. What exactly does it mean? And it seems like it kind of can encompass a lot of area, right?
That's correct. Hip is a very interesting joint because, first of all, it has many planes of motion, so it can be affected a lot in individuals. Second thing is, because of the location, a lot of pain can be referred from other areas of the body and be mistakenly diagnosed as hip pain. That's coming from the hip.
So when you are affected and you know you've got pain in there, when do you know it's time to pick up the phone and give you guys a call?
Well, definitely when you start seeing limitation in your normal daily activities, when it interrupts your work, your sleep, any kind of sports activities. And when the pain becomes to the point that you start thinking about it every day, then it's a good time to seek help.
And I'm assuming hip pain, like probably other pains, really can affect a lot of aspects of your life. So you probably do see a lot of people in your practice that are battling this issue. Yes.
A lot of patients show up with hip pain, and we have to basically sort out what the real issue is at that point. Like I said, it's not only originating from the hip, but it can originate from other areas of the body as well.
Where does bursitis fall into place?
Well, bursitis is one of the aspects of hip pain that is very common. It's more common than you think. And it's a lot of times what I see when I diagnose a bursitis, it's not the main complaint the patient has, but once you start examining the hip and you start touching in the different burses of the hip has a couple of different burses. One is the trochanteric bursa, which is on the side of the hip, and basically this is the site that hurts when you sleep a lot on that side, and you wake up the next morning and you experience hip pain at that point. Is because there's a little fat pad, which is the bursa, which actually gets inflamed because we put pressure on it at night and we don't move. So when you sleep on that side, that's what hurts. That is not a joint thing per se. It's not the joint that is involved. It's just, like I said, it's a fat pad on the side of the joint.
Okay, that's sounding all too familiar as I'm shaking my head. Yes, I'm kind of agreeing, like, yes, I'm kind of checking things off. And, you know, it's scary, though, to think when you do have hip pain, because it's like the worst case scenario could be hip replacement. What can you do to prevent it from getting that far?
That's a great question. So the first thing is actually to talk to the patient and see what the origin of the pain is. If it's a joint thing, then we have to, you know, on the exam, we have to see what the movements that elicit pain are. Then obviously imaging, you know, we have to do some x-rays, and MRIs are probably the best test, with a CAT scan as well. And that can clue us into what the real issue is. At that point, whether we determine that it's a joint problem or it's outside the joint, then we can render the treatment necessary. If it's hip pain, for example, originating from the joint, then we can do some things in order to try to avoid hip replacement as much as possible. There are some steroid injections that we can do intra-articularly, which means we're inside the hip. We do those under fluoroscopic guidance to know that we're at the spot that we want to be at. That way, it will relieve the pain, and then the patient can actually go for some physical therapy at that point. I mean, the injections are not obviously the answer to everything. It's part of the whole process of treatment.
Well, what I really like too about your group is the whole process, how you really get to know the patients before you start actually doing procedures. So again, thank you so much for coming on and talking about hip pain. And for more information on how Florida Pain Relief Group can help you with your hip pain, you can call 844-KID-PAIN or just log on to floridapainreliefgroup.com.